Welcome to the American College of Surgeons Bulletin Brief from the front lines, Surgeons' Voices. With me today is the voice of someone familiar to everyone practicing surgery everywhere in the world, someone who has been our chair of the Board of Regents for 2 terms and is now our President-Elect, Dr. Julie Freischlag, who is the CEO of Wake Forest Baptist Health and Dean of the Wake Forest School of Medicine. Welcome, Dr. Freischlag.
Thanks so much.
Great to have you back with us, and especially in the capacity of President-Elect. I offer firstly my congratulations, and secondly, let you know I'm eager to be working with you again and learning from you. Towards that end, I thought maybe we could all get a sneak preview of some of your plans for your year as President-Elect and your year as President, some of the things near and dear that you'd like to see accomplished.
Well, great. Well, I'm so thrilled to have been chosen. And actually, it is unique, as you know. Wayne Meredith is our president this year, and he's our chair of surgery here at Wake Forest Baptist Health. So having 2 of us from the same institution back to back is the first in history, I think, to do that. So we're real excited about it. And talking with him throughout the year of what he was doing as president-elect, especially in this crazy year of COVID-19 and racial unrest and just so many things out there. He really got involved with a racial equity task force like we've done here at Wake Forest Baptist, really looking at diversity in our population as far as who takes care of our patients, our surgeons, our providers. And I would really like to follow up on that with him. We have a racial equity task force here where we're really looking at the patients we take care of. How do we get more people into the healthcare professions, specifically surgeons? In my field of vascular surgery, only 2.5% are African American. We have an increased number of women, almost 24%, but not African American women and certainly not men of color. So I think looking at the multifactorial way to get more people who are of color into our profession is really important. So the first thing comes along getting them to medical school, and we're working on that here, but then really amplifying that message of what we want to do. And for those that are already in our profession, learning how best to treat them. We've done some work on microaggressions and bystander training here, as well as implicit bias and looking at racial discrimination training. And I think having us all do a better job of those around us, whether it's our partners, our nurses, our students, our patients, that we actually are more open to that. And the one thing I'm learning this year is how to be an ally. I must admit, I was not that outspoken about race or other ethnicity. I was very outspoken about women because I felt I had that competency, but now I'm learning to be an ally for those people that are different than me, that I can speak out on their behalf, saying, I see it, I understand how it looks to me, and how can I help, even though I may not have that characteristic.
Well, Dr. Meredith has done an incredible job of being passionate for this program and introducing it. And indeed, it is becoming now a regential group committee to ensure its longevity and to highlight its importance. So I know we'll be continuing. You're in a very unique position, being a medical school dean and a CEO of a healthcare system, as well as a practicing surgeon. And I know you've been president of the vascular surgery, SVS, and so you bring a lot of different perspectives to the table. How do you plan to integrate those things into your job as president? Because you're on both sides of the table, as it were, as a practicing surgeon, also as an administrator. And fellows sometimes say, well, we're not understood and we don't really have an ally. You mentioned the word ally already. So how do you think you might be able to integrate those to the advantage of our 82,000 fellows and members?
Well, and I think that's the other thing we're very interested in here, as many other institutions. We really have to learn how to be pandemic proof now, right? As we look at how we stopped surgery and started it up, we stopped education and started it up, and we stopped research and started it up. So how do we become pandemic proof in the way we do clinical work as well as research and education? So we are looking for some opportunities to look at the next generation way of education. And I think that's what I can bring to the table to the American College of Surgeons. We also just formed a partnership, a strategic partnership with Atrium. It got announced 2 weeks ago. So I'm the chief academic officer as we start a regional campus in Charlotte. And instead of just starting a regional campus and replicating our medical school, which is a great medical school, we really are going to spend time looking at what is the next generation of teaching us all. How do we become a learning healthcare system that doesn't rely on being present with each other, that we can do it online, we can do it virtually like we've done with clinic visits, that we can teach online, and that we're able to continue to do all those things as well as take care of our COVID-19 or whatever other pandemic we may face. So I think I can bring that to the college. We had a marvelous, as you know, meeting that was virtual. People worked so hard, and I was really impressed in the quality of the presentations, the ability to see multiple things. I think I saw more presentations than when I'm at the meeting, because I tend to talk to people and get sidetracked. And I got to see some of the named lectures and be on some of the chats. So I think coming up with ways that we can talk with each other, be with each other virtually. That being said, I still miss people. There is that human touch. We're starting quite a few meetings now of 5 to 6 to 10 people where we get together with our masks so we can talk about patient care, about each other, because there is that human touch. But I think that ability to look at next generation education through what I do as a dean and a chief academic officer, I can look at too, as we look at the next year's meeting, our continuation of CME, how we give board exams. I'm actually participating in the virtual vascular surgery board exam in January to see how that works. And I think that it's going to change our world on how we travel, how we spend money, and how we do these things for the future. Some of it's really good. Some of it we need to get the in-person back. So I think I can compliment on both sides of that.
And I think while we're thinking about both sides, if I read correctly, the Atrium System was something like 40 hospitals or something that I read. It's a huge complement of hospitals. Are some of the people in those hospitals in private practice, or are they all employed?
It's a combination, as you can imagine. The main hospital in Charlotte has a lot of employed physicians because they have residency programs there. They have a general surgery residency program. Brent Matthews runs that. But some of the groups are private practice, like radiation therapy, otolaryngology. So mainly the core clerkships of the medical students are pretty employed. And then they have multiple other hospitals in South Carolina and Georgia. But the main hospital we'll be partnering with is the one in Charlotte, and then also with their research. And we'll be also building a building down there for the medical school as well as clinical research.
Oh, that's great. So you're representing academic at home, at your home institution, besides for your role in college, be representing academic surgeons and employed surgeons and private practice surgeons, which is great because you can advocate for everyone. You mentioned in-person meetings. Have any plans been made yet? A lot of people have been asking going forward for next year as we think about things like leadership and advocacy, which would normally be in the early spring, and then quality and safety, which is usually in July, or decisions being deferred at present?
Well, I think we have to defer till we know what's going on with the virus, right? There's a little uptick now. When will we have vaccines? When will it be safe? So I'm pretty sure the spring is going to be not known. We do have our leadership conference too for the ACS scheduled in June. That's at, we do that at the Duke Convention Retreat Center. And we have about 70 or 80 people that usually come to that. The other thing is, I think many of us have been restricted in traveling. So I think it used to be mainly budgetary, but now, as you know, we really worry that if you do get on a plane and you travel, even though they say it's safe on the plane, that when you get back, you probably should quarantine yourself, even if you feel like you hadn't been in contact. So I think the travel restrictions also will make the quality meeting, perhaps the leadership meeting, a little tough to do that in the advocacy. I'm really hoping by the fall that we can have a meeting in DC, and that'll be interesting to see how we'll blend it. Because as you know, 3 times as many surgeons checked in with us because of the virtual. So if you are in a small community and you can't get away, either watching those presentations in real time or later, I think we learned really our members want to see.
Thanks very much. I tend to agree with you, of course. Speaking about members, you're going to be president-elect, then president, then past president. How would you like people to get involved in the college during your next tenure in leadership at the helm of the college? Younger surgeons, older surgeons, and do you have any plans for increased accessibility?
Yeah, well, I think, Patricia Turner's just done a great job as we watch the number of members increase each year, both national and international as well. And I think we really serve as a repository for education and ability to talk about new ways of doing operations and how to teach and train. And I do think the vibrancy of our residency program and Young Fellows Association has been amazing. Today, I was actually on a video conference with a young surgeon who is really looking to move because her institution doesn't get involved with the college much. She says she misses it so much. She came from a place where all the residents went to the meeting and everybody wanted to go, and where she presently is, it's not a vibrant part. She misses that solidarity and that companionship and all of that. So I think our young people really would like more of that activity. I think one way to get involved is, now that we know how to do WebEx and Zooms, we can actually have smaller meetings, have more connectivity, perhaps have case studies, even discuss a case. I know we see some of that on our SVS website in a little bit, but it's static. It would be nice to have perhaps, a case conference once a week. My younger partner here, Dr. Velazquez, actually put grand rounds per week and had multiple vascular surgeons do video grand rounds with questions. And so that she has a whole library now of talks and ability to show those, and then have us as the presenter come in and have some questions. So I think there's some ways to really make it educational, maybe perhaps throughout the year, and then get people more interested so they go there as a repository. I'm sure you're thinking about that too, because you're a video person as well. But I think having the flexibility to watch a lecture or talk to an expert or see how they would do the case would be amazing for our young people, and then to connect them. And I think with this whole COVID-19, we've been also isolated. I think we're actually really excited to get back and see each other. I think we'll appreciate our meetings more. So having them come back in a blended form, I think will be welcomed by everyone.
Yeah, I agree with you. And we certainly have lots of outreach programs amongst membership, education, the communications committee, lots of things ranging from social media accounts to webinars. And absolutely, and I know you're going to augment and enhance those different programs, and undoubtedly add some new ones. So I'm very excited to again work with you as your president-elect, and then subsequently when you're president. Any additional thoughts with which you'd like to leave us before we conclude our interview today?
No, I just want to congratulate you on being vice chair, which is great. I remember when I was chair of the Board of Regents, you came on and I was sort of orienting you, and to see you and Scott go to that level is great. I also haven't been in the room where it's happening for a couple of years since I left the Board of Regents a couple years ago. So I'm looking forward to seeing the dynamics of the group, how they're working and speaking, and how we're all going to go forward to get past this COVID-19 issue. It certainly is now a sort of a chronic disease where we actually treated it like an incident command, and we were all revved up to go forward. And now 6 months later, as surgeons are like, isn't it fixed yet? So I think spending some time of our mental anguish about it continuing, I call it sort of COVID-19 gets in the way every day. But I do keep a list of what has COVID-19 done for me lately. And it's not a long list, but it has allowed us to see post-op patients in a video, which is much more comfortable for them. And it has allowed us to have better attendance at grand rounds and meetings to do that. It has allowed us, as we're doing some building here, I don't have to build another parking garage because there's lots of people working from home. So as I build my new critical care tower and that, I actually can not be focused on parking and other issues. I can actually be focused on the real thing we need, which are new operating rooms. And I do think we need to look at our value-based care as we go forward. You know, surgeons are going to be very valued as we look at what has happened with routine surgery during this time. Dr. Meredith and myself, along with our president, Dr. High, wrote an article for JAMA about how we really can't stop essential surgery in the future. How are we going to manage that in each of our networks and our groups to make that happen? And it really has made us move a lot of our procedures to outpatient, a lot of our care to home for our patients, and really looking at them in a specific way. So as they enter into an operation, they're the best they can be so that their opportunity to get better faster after our procedures are there. So I think all those things together can actually make us appreciate our essential surgery as we go forward in a new way.
Thank you very much. I really appreciate your time, your insights, your leadership. Again, congratulate you, and again, look forward to working with you.
Thanks so much, Steve. Me too, and have a great day.